Hi again, I'm Dr. Mark Trolice, the Director of Fertility CARE in Orlando, and with me is Christina. We've been chronicling her journey of surrogacy. Now, we haven't forgotten about Christina. The last time we spoke was about a month ago, but we have more information. She had been on birth control pills for several months, and Christina, tell us the new development.
Well, I've ovulated, so cycle is canceled.
Cycle is on hold,
On hold.
And it hasn't canceled, right?
Right.
Okay, what ovulation means in this kind of setting is that her lining of her uterus has seen the hormone progesterone earlier than they would like, okay? So a typical protocol with frozen cycle is that you're on estrogen to build up the lining of the uterus, and you were saying estrogen pills?
Pills, 3 times a day.
How long were you on those pills?
I'd say about a week and a half to 2 weeks.
Okay, so she was just on the estrogen, and they were not using an ovulation suppressing medication, which we have used for years, and a lot of people have stopped using them, and we have as well. It's called leuprolide acetate. So they were monitoring her, and her ultrasound showed that she had a large cyst on her ovary, a follicle cyst, and that was showing that her ovaries were breaking through the suppression, and unfortunately her progesterone level in the blood was elevated, which means that she ovulated, okay? The reason that they have to defer the cycle is because now the lining of the uterus is not a controlled synchrony with the embryos. The embryos have to go back at a certain time from the number of days of progesterone that the uterus sees. Okay, so what do we have now? What's going to happen now?
I stopped my estrase. I have to start another period. We'll do another ultrasound to make sure ovaries are quiet. And they said we would meet back and just discuss what we're going to do to move forward.
There's different types of protocols that are used for a frozen embryo replacement cycle. We use estradiol patches, natural estrogen. It's very well absorbed. Rarely we'll get a patient that breaks through ovulation, but when they do, unfortunately, we defer the cycle, but it's not canceled, it's just going to be delayed because we're going to get Christina to have baby, and we can chronicle that throughout her journey. So what else? How are you feeling with this? What type of setback is this for you emotionally?
I feel okay. I feel really bad for the intended parents. They're wanting to move forward, and I feel like every time it's always something, but I'm okay.
Are you communicating with them?
Yeah, absolutely.
How did they take the news?
They were upset, disappointed, but there's nothing they can do.
Yeah. It's going to happen. There's definitely ways to overcome this, and Christina, being the trooper she is, we're going to be able to get this cycle going for her. So we thank you for your interest, and what you could do is send us questions if you do have them. We'll be happy to answer for you next time we go on our video. So until next time, Dr. Mark Trolice and Christina, take care.